This is Chapter 2, Current Mental Health Care Systems. The tape will play for you to read learning objectives. You may pause it as you wish. As you read, in Canada, since the 1960s, they have a single payer arrangement. They use and base it on 5 specific principles that is universality, portability, accessibility, comprehensiveness, as well as public administration. Universality is everyone in the nation is covered. Portability, meaning that people can move and still retain their health care coverage. Accessibility, everyone has access to the system's healthcare providers. Comprehensiveness, provincial plans cover all medically necessary treatments. And public administration, the system is publicly run and publicly accountable. In Norway, financing and healthcare services occur actually on 3 different levels. The health policy is legislated, and the delivery of the health service is monitored by national authorities. Primary health care services are actually organized at the municipal level. Mental health care is blessedly available to all the citizens of Norway. And treatment services for mental health care cost millions of dollars annually. In Britain, physician services, emergency surgeries, hospital stays, prescription drugs, and preventative, home, and long-term care are all provided by the government. The only care that is not included is eye care, and their dental care is limited. Otherwise, basic health care needs are met. In Australia, the national or the federal level, they make all the policy and budget decisions for its citizens. The actual individual state territories, they administer and deliver the services that are available through the government agencies. Currently in the United States, Medicare, which is federal funding, and state funds, which is Medicaid, are used to cover costs both in the private and the public sector. Medicare currently funds roughly to 30 to 50% of all the mental health systems. The severity of an individual's illness, their level of dysfunction, whether or not the setting or the institution is suitable for treating the problem, the cooperation of the client, and their ability to pay for services all go into the decision for inpatient care facilities. Discharge for these individuals occur when the patient's behavior has improved and treatment goals have been met. The most important thing about inpatient psychiatric care is that it has a safe and a secure environment for these individuals. An outpatient setting allows patients or clients to be treated for their mental illness or mental disability within their own home. These individuals are assessed related to their actual environment, and their therapies are designed to assist them to function appropriately within their community. When individuals often are unable to cope in their community, people that have chronic psychiatric issues, they will return to an institution or use community services on what is considered a revolving door basis. This behavior pattern, is known as recidivism, and it actually means a relapse or a return of a symptom or a behavior. The community support systems model views individuals on a holistic or a whole patient basis. They look at them as individuals that have their own needs, ambitions, and their own rights. For community health, actual services focus on prevention, maintenance, treatment, and rehabilitation of mental issues. Looking at emergency room care, oftentimes chronically mentally ill use an emergency department as an entry into the actual mental health care network. Residential programs will provide food and shelter, clothing, counseling, supervision, training, and socialization. Partial hospitalization is also known as a day treatment center. In this type of care, it is multidisciplinary, and treatments have led to client success and proven effective with these programs. Psychiatric home care, these individuals actually collaborate with the patient or the client and the family and other professionals to provide ongoing care. And community health centers, they actually currently lack adequate financing, and they have resulted in fragmented care for our population of individuals. Psychosocial rehabilitation is the use of multidisciplinary services to help individuals gain skills needed to carry out their activities of daily living and be as independent as possible. Consultation is a method that seeks assistance of a specialist to help identify methods or ways to work with specific problems. Resource linkage is matching patient or client needs with appropriate community services. Advocacy in mental health is providing the client with information so they can make appropriate choices for themselves. Therapy is provided on an individual basis. It is assessed according to needs, the population, as well as available services. And crisis intervention is an active therapy that focuses on solving immediate problems and restoring the functionality of the client. Crisis services can stabilize, prevent further deterioration, and support the readjustment process. The multidisciplinary team fulfills the need to coordinate both services and treatments because it includes the client as well as their family in the treatment process. The client population that is listed are at high risk for developing mental health problems. These individuals may live far from home. They may have PTSD. People that have HIV, they're using mental health services. Problems for these individuals are impairments with their memory, judgment, or concentration. People that live in rural communities, they are on the countryside and their hospitals are far and few between. And military personnel or our veterans, they are war affected. Many of them have PTSD because of what they have witnessed when they've been fighting for our country or others. People that are diagnosed with HIV have a fear of AIDS, and it is believed that this may hasten their onset of potential complications. AIDS-related anxiety will increase their everyday apprehensiveness. So treatment facilities that offer comprehensive service focus on patients with AIDS, their families, their friends, and as well as the public. Family and friends are encouraged to join support groups. Respite care is time off for the caregiver. Community groups provide education to the community to help provide prevention strategies and education about about AIDS for everyone that lives within that community. Mental illness affects everyone either directly or indirectly. It is believed that 1/4 of the population of the world will experience a mental illness sometime in their lifetime. Roughly 18% of the American population of adults has some sort of mental illness. Currently, if individuals are not discharged and their time has run out, then their payment for their treatment is actually ceased. So mental illness, besides influencing economics, it also influences the unemployed, the homeless, and troubled families. This is a cost to our society in multiple ways. When you're looking at social issues, they are related to some mental illness problems, but most mental illness individuals, they struggle with just basic day-to-day living. A lot of them live in poverty, they're homeless, or they have substance abuse.